Ladies and gentlemen, fellow Kenyans, today I want to invite you all to join us in celebrating our heroes in the front line. We cannot emphasize enough how indebted we are to our health workers, medical staff, security forces across our country. Against all odds, including the novelty of this disease, they continue to make immense sacrifices. We are committed to protecting them and to ensure that they are accorded the necessary support in executing their responsibilities and duties. Let us all spare a thought for those heroes and even say a prayer for them. Yesterday, we put counties on notice that the virus is fast slithering to their territories. Early today, I dispatched a high-level team from the Ministry of Health to Siaya County on an urgent mission. The team, which is led by Acting Director General of Health, Dr. Patrick Amoth, is currently examining the status of the quarantine and isolation facilities in Siaya County. They are also engaging with the county leadership and local residents to ensure that we are moving in one accord against this virus. In addition, the team is also delivering supplies for personal protection for the medical staff and healthcare workers in the region. As I have repeatedly said, this battle will be won not by the government, by Kenyans working together. This is not a government task. This is a community. It's a community of Kenya task. And this is what is happening in Siaya today. We are aware that the game changer in all this will be mass testing, isolating, and treating. This is because we will be able to isolate cases, including asymptomatic ones, in good time before they are spread. Using the risk profile approach announced yesterday, we are working around the clock to double our sample collection and testing capacity. One of the main dampers in our mass testing plan has been the lack of reagents owing to their unavailability in the global supply chain. I am delighted to announce that today, with a lot of gratitude, we have received a consignment of some 18,900 swabs and viral transportation medium. We have received about 18,912 extraction kits, 3,390 medical disposable protective clothing, ventilation machines, thermometer guns, and medical gloves from Jack Ma organization. We are very grateful indeed to Jack Ma. Let's not forget, he had sent another consignment of 25,000 testing kits. This afternoon, we have also received another consignment of surgical masks, gloves, face shields, gowns from China, Germany, and France through the World Health Organization. A lot more PPEs will be available and distributed before the end of this week. One of the things we are trying to do is to optimize the capacity of the kits available. We have therefore been working flat out to enhance the capacity through training of manpower to undertake these tests. Let us not forget that we cannot test samples that we have not received. And therefore, what we are enhancing is our sample acquisition capacity. And that's what we are working on this week. Having received the 12,000 kits that came from the Roche, for the Roche machines, we have substantially increased our capacity to do mass testing. Fellow Kenyans, we are aware that there are those looking at our figures and celebrating a bit too early. Let me send out a word of caution. We are not out of danger. A comparative review of the countries now being overrun by the virus shows that they were reporting similar figures as we are now. You will note that our 4.6% death rate is within the global range of 6.3%. Our figures should therefore not delude or deceive any of us into dropping the ball. Let us stick to our plan and uphold it. Contact tracing, isolation, quarantine, testing, social distancing, face masks, and basic hygiene, washing your hands as much as you can, will make the difference for us. Let us enforce these measures with a religious zeal. Do not wait for us to come to you. Instead, let's run ahead. In this regard, we are deeply perturbed to see a section of Kenyans who are not cooperating with the police. This is akin to inviting anarchy when you see people taking a stone and throwing to a policeman. That is akin to inviting anarchy. When the rule of law is broken to that extent, then you know that you are inviting a bad situation. While we condemn this despicable behavior, we are also requesting our civil society networks to equally vouch for the rights of the police. In instances where the police have overstepped themselves, we have seen condemnation from all sorts of organizations, human rights, and so on. And I thought that for once, I was going to see the human rights organizations condemn those who are misbehaving with the police. And also sensitizing our people on the importance of obeying the law. I would like to take this opportunity to commend the police for ensuring that the nationwide curfew is obeyed. The curfew has had several advantages, including less movement, therefore less contact, therefore less infections. And I have no doubt in my mind that the work that the police is doing is assisting us in mitigating the kind of situation we could possibly be in. Therefore, I plead with all Kenyans to continue observing the curfew and lend the police their cooperation. We are not trying to protect the police. You are trying to protect yourself. So let's cooperate with security forces so that at the end of the day, we all benefit out of it. And it is concerning, to me it's very concerning, when you see the kind of behavior that we saw in Malindi. And I think it is only fair to expect that in every situation, the police are supposed to assist you, but let us not also forget that the police must also address each situation with the sensitivity that is deserved. Yesterday, we also pointed out that because of the new measures that we have taken and arising out of a new social structure, there are increases in domestic violence in homes. And I want to make a special appeal to our religious leaders to also weigh in and intervene in this matter, to counsel our people against these emerging trends, and to say that the stress level in our country is going to increase. You are going to be challenged in living in a way that perhaps you have not done for a number of years. Is a new normal that we are not used to in a lot of our homes. But I think that the way to look at it is a challenge to overcome. Let us not ventilate. Let us not use our spouses, our daughters, our sons. Let us not use them as a way of ventilating our stress. In the last 24 hours, we have upped our testing capacity, as I mentioned, and tested for the first time over 800 samples, and hopefully we can begin to double even that number. But during that period, out of the 803 samples, 9 people have tested positive, bringing to 225 the number of confirmed cases in the country. And I would like also to mention that all the 9 cases are Kenyan nationals. And also, none of them has a history of travel, and none of them was in a quarantine center. These are people that we have tracked through contact tracing, and also testing people who come to us because they are feeling unwell. And out of those 9 cases, 5 of them are from Nairobi and 4 of them from Mombasa. They are aged between 9 and 69 years old. We have 12 new discharges, bringing to 53 the total number of people who have recovered from the disease. Unfortunately, we have also lost 1 person, bringing to 10 the total number of people who have died as a result of the disease. A total number of 2,336 contacts have been monitored, out of which 1,911 have been discharged. 455 contacts are being followed at the moment. I want to take this opportunity to condole with the family of the person who lost his life, and also to take this opportunity to wish a quick recovery to those who are affected in isolation areas. I want to emphasize the need for using masks, and to say that there are some sectors of the economy, sectors of the activities we do, that have not taken seriously what we are saying. And I want to once again appeal to our border operators to adhere to the measures that we have said. It is in their enlightened self-interest to do so. Let us all stand up for our country. I thank you. Before I can take 1 or 2 questions, I want to invite Dr. Kamuri, the CEO of Kenyatta National Hospital, to say a little bit about the mass testing that is going on in Kenyatta. As I said yesterday, the mass testing is going to be in an organized manner. I would also like him to talk about the state of affairs of those in isolation and the general preparedness of our medical staff. Dr. Kamuri.
Thank you, Waziri. And again, thank you for giving me this opportunity. I'll start by saying that Kenyatta National Hospital has been the center, and I know there has been confusion about Kenyatta National Hospital, IDU, and Mbagathi IDU. Both are one and the same. It's only that we have two centers, one at Kenyatta and one at Mbagathi. We are the same people who are also running that one in Mbagathi. That isolation now, basically, we are only having the positive cases, but we are also doing also the triaging at that point where we also put people in other areas for quarantine and such things. The good thing is to say that most of the people we've had and the centers are in good care. We are maintaining them, and as I said, and even now, Waziri, I will still insist, there is no particular cure or treatment for coronavirus. What we are doing is symptomatic management. We have to manage these cases as per and how they present. And more so if they have other comorbidities. For example, if they are diabetic, hypertensive, renal issues, cardiac issues, cancer issues, all these are the ones we maintain. And the more we maintain the patients, more often than not, they tend to recover. And as Waziri has said, people must take things seriously because you don't know. Virus behave differently to different people. So whenever, don't start relenting your effort because you think people are getting well. It is always important for all of us to take our responsibility and let us start behaving. Especially some of the people who go for these areas of quarantine, they are becoming so hostile even to the workers. Even some of my workers have had to be physically abused by some of you who have been out there. Please, these people are out there. They are putting their life at stake. The least you can do as Kenyans is to give them some little basic support and even show some level of etiquette. But we have also started, because we, as Waziri said, we are taking healthcare workers seriously. We have also started testing the health workers in the hospital. We started yesterday. We launched the program with Madam PS yesterday. Yesterday we tested close to 100 healthcare workers, and we thank God that most of them, and all of them, the ones we tested yesterday, were safe. And we are doing targeted testing. We started with the front liners, the people who are in the front. We are also going to accident and emergency, ICU, renal, wards that are involved, like that. At the end of it all, we'll have finished with all the health workers, and again, we'll restart again. We keep restarting again. Again, I'm happy to say we also started a facility in Kenyatta. This is for healthcare workers. Wherever they are, once they get positive, we are sending them there, and also they are being taken care of by the other healthcare workers. Thank you, Waziri.
The CAS, Dr. Mercy Mwangangi, listed 21 counties that have reported cases of COVID-19. Probably are these cases in those counties? And if yes, because we already know there are some restrictions in 4 counties, Nairobi, Mombasa, Kilifi, and Kwale, are we expecting similar restrictions, especially on the inter-county movements on the additional 17 counties? And then number 2 is on the use of masks. Probably, is there something that you are doing as a ministry in regard to the hawking of masks? Are they probably, the hawkers, following the guidelines, especially on the hygiene of these masks, even as they sell them to their clients? And lastly, sir, it's past a month since maybe the restrictions, especially on gatherings and, of course, social distancing were imposed in the country, and this has affected people, especially businesses and sources of income. We've seen other nations like Nigeria begin a plan on offering food to their citizens, probably, and also you've been saying that Kenyans should prepare for the worst. Are we as a nation working on helping the most vulnerable? Because it's true, there's someone who slept hungry today, there's someone who's been locked out of their homes as we speak.
Okay, thank you very much.
Stephen Leto from Citizen TV. My question, you've projected that the country is still within the danger zone. What is the projection from the same ministry on flattening the infection curve? And the US has cancelled their funding to the World Health Organization. There could be other projects in Kenya under COVID-19 pandemic that are ongoing, being funded by the WHO, that will be affected with that. And what is the status of the closure of the mandatory quarantine centers? Thank you.
As a follow-up to that other question, and with regards to, my name is Kennedy Muredi from NTV. As a follow-up to that and the grim picture that you're painting, that 9 are all Kenyan and they are not from the mandatory quarantine facilities. What are we also expecting with regards to mass testing in line with the question of, are we as Kenyans going to take ourselves to Kenyatta, or how will it be rolled out in an effort to probably know the extent through which the virus has permeated to Kenyans?
Okay, thank you very much.
And also the question on, there are some foreigners within the Kenyan borders who would want to go back to their countries, but there is no provision from their countries to pick them. How is the Kenyan government probably helping such, and have you heard of such a case?
Thank you very much. Let me start with the last one, Ken, about foreigners who would like to go. As we said quite a while back, we said that if there are foreigners here, and if their governments wants to take them out of Kenya, then we have no problem at all. They can come and evacuate their nationals. The only condition we put is that their planes would come empty and then just take the nationals and leave. Nobody has stopped in a foreign nation from doing so. But if they want to stay in Kenya, then they are welcome to do so, and we will take care of them in our usual manner of taking care of our guests. As for the contact mass testing, I think I'd alluded to that when I spoke about the manner in which we have started doing this. We will continue to expand. As I said earlier, one of the challenges we have been having is our capacity to take samples. Fortunately for us, part of what we received, is quite a bit of support in our sampling capacity. So we are working on protocols to do so. In fact, today, before we came here, the permanent secretary, the principal secretary, was working at exactly what we are going to do in terms of protocols that will allow us even to be able to do in open areas, even to work in open areas. But we will do this systematically. We don't just want to walk into a place and without any plan, start testing. We are doing surveillance work today, even in Kibera. We have got a team that is going around with thermal guns and just taking temperatures and just trying to see whether there is any concern or whether there is any area, whether there are people that we should be taking further into a testing stage. So it's organized, and we are going to do it in an organized manner for maximum effect.
So as of now, I just walked into Kenyatta and probably I'll have my test take.
Well, if you walked into Kenyatta and you are showing symptoms and you are looking like you should have a test, then they would. But if you walk in just the way you are now, Ken, I doubt whether they will take you very seriously, because I hope. I wish you the very best. Don't ever go there when you have it. As for Steve, you talked about projections. The projections we are making. We are making projections regarding, if we play it the way we are playing it at the moment, if we continue with the testing, with a more improved testing, therefore more isolation, because the more you test, the more you are likely to create quarantine facilities and isolation facilities. If we do that, then we have a projection where then the growth in the numbers will not be the growth that we have seen in other countries. I think it is important to appreciate the following, that at the time we are now on the day 33, some of the countries that are experiencing very, very serious situations had not even started testing. Forget about us who have done 5,000, 8,000 people or so. Some of those countries had not started testing. At the same time as we are in today, I think Spain had tested something like 5,400 people, as opposed to our now going towards 9,000. And by tomorrow, I'm sure we'll hit the 10,000 figure. So what we are saying is that because of different activities in different countries, we can only be able to say what we can see from our own nation and compare perhaps with similar actions in other countries. Korea being a good example of what we are doing is very close to what they did. But let's not also forget that Korea did experience, a substantial amount of positive cases. So the figures depend on what we do. Worst case scenarios, there are scenarios that have looked at us and said that we are going to have 2-3 million positive cases if we do not do what we are supposed to do. And on the other hand, there are people who say if we continue, then we could easily, just continue the same path and hopefully at some point just taper down. But that's the best case scenario, assuming that a Kenyan is as disciplined as Steve. But when they are not, purity on inter-county movement. As you know, we have discouraged movement anyway. We have discouraged movement anyway. We have said, forget even about being told by the government that you stay at home. You should stay at home for your own safety. Given the circumstances that are out there. I have said, and I'll repeat, assume that the next person that you are meeting, the person you are talking to, the person you are engaging with is positive. I have said that, and I repeat it again. When you make that assumption, your behavior automatically changes because you begin to see how important it is to protect yourself. So we have not banned inter-county, cross-county movements at the moment, but that is at the moment. The situation, as the situation evolves, then the measures that we take will also evolve. But right now, we haven't done it. As for the situation on the masks, we have spoken about this subject almost every day and said that there are standards that KEBS has set up for production of masks. And I'm glad to say that there are numerous organizations now that are making masks, and selling them all the way from 5 shillings to 15 shillings and some very sophisticated ones, to 50 shillings and so on and so forth. I can tell you that mine, this one is about 5 bob, and when you wear one with 5 bob and to top up with your patriotism, then it's a good call. So what I'm saying is that the measures should include and will include how you handle the mask. Because you can't go holding a mask with dirty hands and then hooking it to somebody. Ideally, it should be in a pack so that nobody else is going to touch it except yourself. The beauty of some of these masks, especially the cloth ones, is that they are reusable. And you can buy it and wash it before you use it. So that if you have got the one you have now, Purity, you can take one of these, use that one today, wash this one, it's clean, and then you can use it tomorrow, because we are aware that part of the handling of masks is not hygienic. But you'll continue to improve and tell people on how to handle these masks. I have just told you that don't just go buying a mask from a person who is looking dirty, a person who is not who you can see is not washing their hands. Don't buy, because it is dangerous to do so. As far as gatherings are concerned, we still maintain exactly the same position, that we do not want to see any gatherings. It is against the law now to do so, to call for gatherings. And we have expressed the reason why. And we know that it is bearing fruit. I mean, one of the things that I would like you to ponder about is that we have had, as I have just mentioned, over 200 cases in the country. Now, imagine that all those 200 cases had been out there in the streets, each person affecting at least 4 people instantly, and each of the 4 people affecting another 4 people. So you can imagine how that would be. And suppose you are in a gathering. You know very well what happened in Kilifi because of one person going to a gathering in a funeral, and you know the numbers that grew out of that. You are also aware of the Kitui one and what happened. You are also aware of the Siaya one and what happened. So it is self-explanatory really. And the reasons for avoiding gatherings is obvious. Internationally, we know that in Italy and in Korea, those numbers grew because of gatherings in religious, because of religious gatherings. So I would just like to state that this is something that our communities must work to avoid. And our communities must call out whenever they see something like that happening. So thank you very much.
The question on WHO.
Which is that one?
WHO.
Oh, yes.
Concern on the 21 counties that were listed yesterday to have registered cases. Were those cases picked in those counties because some governors are not aware about these cases? And then
Okay. Well, yeah,
And where we'll get the 5 shillings masks.
You can see me. You can talk to me later about that.
No.
But
Kenyans are the ones who are sending messages.
They are all over the place. There are about 600 people now who are making masks. For the last count that we got, 600 of them. So you should be able to get even a cheaper one. On the issue of the World Health Organization, this obviously is an issue of concern to those of us in Kenya, because the minute you hear that the World Health Organization is pressed, obviously we begin to get concerned. And we hope, we have not had any reduction in our association with the WHO. As you have just heard me say, they are the ones who are continuing to assist us. We are also aware that the UK has also given the WHO a substantial amount of money. But of course, we would be concerned about the operational capacities. But the WHO has not in itself, pronounced itself on this issue. And therefore, we hope and trust that these are issues that are being discussed at that level. And hopefully, some form of agreement will be met, because the United States is a very important part of the global funding mechanism. As for the counties, I think I answered that question, because what I said was that we are not closing the boundaries. And this is specifically because when we analyze the data, we analyze it from an origin, where one comes from, not where one was tested. So that if here there is a case from Nyeri, probably one originated from there, got tested here in Nairobi, and is listed as a Nyeri case. But chances are that they were tested here in Nairobi, because a lot of those counties do not even have testing capacity. Thank you very much.